Washington, D.C. Forward by Representative Pramila Jayapal. Medicare for All, a Citizen's Guide, was written during an unprecedented crisis. As of November 2020, the COVID-19 pandemic had claimed more than 240,000 American lives, a striking number that is greater than the number of American lives lost during World War I. This public health crisis also triggered the worst economic crisis since the Great Depression, with more than 45 million workers filing for unemployment. And that mass unemployment crisis became a mass uninsured crisis. Millions of people lost their health care simply because they lost their job, joining the 87 million people who were already uninsured or underinsured. Next to the sheer devastation of massive numbers of deaths, the most striking injustice has been the tremendous racial disparities of COVID-19 deaths and illness. Black Americans have nearly 5 times the odds of being hospitalized as white Americans, and are twice as likely to die from COVID-19. In the midst of this emerging news came the deeply necessary and incredibly painful awakening of millions of Americans to the horrific legacy of white supremacy, racism, and anti-blackness. As George Floyd cried to breathe, America had its reckoning with police brutality and institutionalized racism. Not new, certainly, but brought to the forefront with the multiple crises that faced our country. COVID-19 shed a light on problems that existed long before the pandemic, including the deep lack of health care that led to too many Americans with chronic health conditions that have been unable to access care. Nearly half of all adults under the age of 65 were uninsured or underinsured even before the first American tested positive for COVID-19. Black Americans, Latinos, and indigenous people are much more likely to be uninsured. For many of these individuals, COVID-19 threatened not only serious illness, but bankruptcy. And while prior to COVID, arguments kept being made for how Medicare for All would destroy the choice that an employer-sponsored healthcare plan offers, no one made that argument after COVID hit. Then, tens of millions of Americans lost not only work, but also their employer-sponsored insurance. Now more than ever, we saw exactly how unsustainable it is to have a corrupt, for-profit healthcare system that ties insurance to employment. It is a well-known fact that Americans pay more per capita for healthcare than any other country in the world. And yet healthcare in America, a patchwork of services with enormous gaping holes in coverage and cost, rather than a system, leaves millions without access to life-saving treatments. This patchwork of services squeezes out billions of dollars in profits for health insurance companies, even as 500,000 Americans go bankrupt every single year because of medical bills. We all know a story of a family member, friend, or colleague who has avoided getting the health care they need or filling a prescription because they couldn't afford it. In the richest country in the world, this is an outrage. But all is not lost. There is a solution that has been tested and works in major countries around the world to guarantee health care to every person without premiums, unaffordable out-of-pocket expenses, and exorbitant prescription drug costs. It's a solution that includes reproductive health care, dental and vision, mental health, and long-term support services for our elderly and people with disabilities. That solution is Medicare for All. It's a solution that simply cannot come quickly enough. Every second we wait is more lives lost. I am the proud lead sponsor of the Medicare for All Act of 2019, which would guarantee comprehensive health care to all U.S. residents. As the co-chair of the Congressional Progressive Caucus and co-founder of the Medicare for All Caucus, I have worked tirelessly with the Medicare for All movement that has swept our country. As the National Health Policy Chair for Senator Bernie Sanders' 2020 presidential campaign, it was an honor to work with outstanding champions like National Nurses United, Public Citizen, and the powerful Medicare for All grassroots movement to ensure